billion prayers for Yuvi. He's getting some really hard medicine against cancer in a Boston hospital. But what is the science behind detecting this type of cancer, and what exactly is the process of administering chemotherapy? Headlines today's Akash Banerjee met with senior oncologist Dr. Samir Kaul at the Apollo Hospital to understand the treatment that Yuvi is getting right now.
Proceed to confirmation to confusion. There has been a lot of reporting that has been done on Yuvraj's health over the last 48 hours. But what exactly ails Yuvraj, and what sort of treatment right now is he going through in Boston? Well, we are here at the Apollo Hospital. Dr. Kaul joins us here. He's a senior oncologist at Apollo Hospital. So, first and foremost, let's take the whole myth out of it. It is not lung cancer. It is not as serious as it was intended to be or initially made out to be.
Well, you're right on both accounts. It's not a lung cancer. It is what we call as the mediastinal tumor, which is near the lung, near the heart, near the main vessels which come out from the heart, particularly what we call the aorta. But it's not a lung cancer. It arises from different cells. The second one, it's better news than a lung cancer because it is very responsive to therapy.
Okay. What would the doctors have seen initially when they would have scanned Yuvraj? Take us through exactly what is the medical science behind scanning a body and actually understanding where the problem lies.
I think first you must have complained of a cough or a breathing difficulty because it's next to the lung, so it would impair with the lung function. And so you must have had gone to a doctor. The doctor would have probably asked for an X-ray of the chest, and seen a widening in a particular area on the chest would have asked for a CT scan. So the crux of the matter is a CT scan of the chest from the root of the neck down to the lung, and to see there is a small lesion there, which is a nodule there. And the next important thing, and if I can show that to you, what a mediastinum is. This here is the breastbone, the bone in front. That's the heart and the great vessels. That's the lung on its side. So this area here is the mediastinum, and that's where they would have noticed a mass.
So close to the heart and the lung, but not a lung cancer.
Absolutely.
But in a very delicate position.
In a delicate position.
So this is how the whole thing has been found. Now let's of course go to the other aspect of the treatment. Dr. Kaul has actually volunteered to take us into the chemotherapy lab. We go into the lab and see what kind of machines right now are working their magic on Yuvraj Singh.
One of the most vital parts of the chemotherapy treatment is this machine here. Now that is a laminar flow area. This is where the chemotherapy drugs are mixed. People with gloves, because it's all sterile. Yahan infection ki koi chance nahi. So they're mixed here, and therefore for the patient in their prescribed doses, and then administered to the patient, which I'm going to show you next.
We've shown you how the diagnosis is done. We've shown you how medication is prepared for chemotherapy. Let's take you through exactly how it is dispensed. We are in this sterile room at the Apollo Hospital where medication is being given to one patient. We are not showing you the face of the patient because that's the hospital rules. Dr. Kaul, take us through exactly this patient could have been Yuvraj Singh. We have every possible medical science available to us. It's just perhaps for other reasons he's not in an Indian hospital.
Probably for social reasons, but all that's possible right here in India. And I'm sure in many places in India. Now, it's very simple. Once the drugs have been mixed to the required dosages in the laminar flow area, just let the patient lie down comfortably or maybe even sit up if he feels like, watch television in a nice atmosphere with pictures on the walls with his family members by the side. Put the drugs through this channel into this in the required dosages, and the IV line then goes through something here called the infusion pump. This decides the rate at which it's prefixed, rate at which this drug will then through this IV line be administered and go into the venous system of this body.
And this chemotherapeutic drug is doing what to Yuvraj over the next 10 or few weeks? What would it do? It would corrode away that lump.
It will hopefully kill the cancer cells that are alive in his body, and also distribute itself through the bloodstream to various parts of the body so that this tumor cells don't go and lie in other parts of the body and constitute spread of the disease. So in other words, it kills the primary tumor, and it also kills various malignant cells which may be roaming around in the blood. So
Dr. Kaul, thanks for explaining the whole situation and exactly how the drug is administered. That is exactly what is happening right now. Yuvraj, in all probability, in the Boston hospital, would be in this condition, watching TV. He's been catching up, of course, on his movies, and he has a very positive frame of mind. Of course, he is getting the best medical treatment as well. That's all we have for you, at least in this explanatory story on Headlines today.